So good day, I am Jim Sergo from BSN 212G, and today I'll be performing a female catheterization. So catheterization is a medical procedure involving the insertion of a thin, flexible tube called a catheter into a patient's body through a natural orifice or an incision. It is commonly used to access and treat various parts of the body such as the urinary bladder, blood vessels, or the heart. So first, we're going to check the doctor's order for the catheterization. So this is to ensure the procedure is authorized and necessary for the patient's care. Okay. Next, I'm going to perform hand hygiene to deter the spread of microorganisms and to avoid cross-contamination between me and my patient. So next, I'm going to identify my patient and explain the procedure. So, good morning, ma'am. I am Jim Sergio, your student nurse for today. So, for the verification, may I see your wristband? And please state your full name and your birthday. Thank you. Ma'am, today I'll be going to explain you the procedure that we'll be doing to do with you. So, we'll be doing the catheterization. So, this is allows you to urinate since you can urinate properly. So we're going to add a tube in your urethral opening. So it allows you to empty your urine in the urinary bladder. So, ma'am, before we proceed, do you have any clarifications or questions before we proceed the procedure? Okay, thank you. Okay, this is ensure that next is I'm going to close the door to provide privacy and position the patient. So respects patient's dignity and facilitates proper access for the procedure. Okay. Then I'm going to drape the patient, exposing only the area to be used. This maintains a sterile field while ensuring patient comfort. So, ma'am, I'm going to drape and expose only your genital area. Okay, now, I'm going to apply direct light for visualization of genital area. This is to ensure accurate and safe visualization of the procedure area. And now, I'm going to open the tray and arrange equipment for convenience and accordingly to avoid contamination of sterile items. So this is to ensure efficient and sterile preparation of all materials. So next, using the sterile forceps, I'm going to cleanse the area using cotton ball with betadine. This is to prepare the procedure site by disinfecting the area. Now I'm going to sanitize your area. Then now open the set observing the sterile technique. So as you can see, I have opened it already. So prepares additional sterile supplies while maintaining aseptic conditions. Next, I'm going to put on the sterile gloves. This is to maintain a sterile field and prevents contamination during the procedure. So first, before I'm going to put my sterile gloves, I'm going to put off my wristwatch. Okay. So next, I'm going to put the eye sheet. This is to maintain the sterile environment while protecting the patient's privacy. So ma'am, I'm going to put the eye sheet in your perineal area. Thank you. And next, I'm going to hang the catheter bag. Then next, I'm going to lubricate the catheter for about 1.5 inches. Being careful not to plug the eye of the catheter. This is to facilitate smooth catheter insertion while preventing blockage. Okay, then, so next I'm going to pick up the catheter at least 3 inches from the tip of the thumb. Then place one finger on the left or right hand between the labia minora, separate and pull up gently. This is properly positions the catheter for insertion while minimizing contamination risk. Just like this. Then insert the catheter into the meatus for about 2 to 3 inches or until urine begins to flow. Safely, just like this. Okay. This is safely places the catheter in the urinary tract to facilitate urine drainage. So, if a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. This is doing if necessary to collect urine specimen if required while maintaining catheter replacement. So, next I'm going to rest the hand in the pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. This is to prevent accidental displacement of the catheter while ensuring the patient's comfort. So, next I'm going to connect the catheter to the urine bag. Okay. Then, inflate the balloon to 10 to 15 cc of sterile water using the 15 to 20 cc syringe. This is to secure the catheter in place and prevents its removal. This is to then we're going to inflate the balloon. Now, secure the indwelling catheter by tapping it to the patient's thigh. Allow some slack of the tubing to accommodate the patient's movement. So, now I'm going to put the This prevents the catheter movement while accommodating patient's mobility. So next, I'm going to place the patient comfortably, so ensures patient comfort after the procedure. So I'm going to discard the eye sheet. I'm going to seal. Discard properly the eye sheet. Then I'm going to discard my sterile gloves. drape the patient to ensure the comfort and privacy of her perineal area. So next, do the aftercare and record the time of the procedure, the amount and color of the initial output. So this is completes the procedure, ensures the patient comfort, and maintains the accurate medical records. So thank you for watching, and that's all.